Brenzavvy 20 mg tablet is used along with a proper diet and exercise program to control high blood sugar in people with type 2 diabetes. This helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. Proper control of diabetes may also lessen the risk of a heart attack or stroke. Brenzavvy works by increasing the removal of sugar by your kidneys. It is usually taken once a day, with or without food, and the dosage is determined by your doctor based on your medical condition and response to treatment. Taking it at the same time each day will help you remember to take it. Before you start taking Brenzavvy 20 mg tablet, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily in the morning. Do not crush or chew the tablet. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. If your condition does not get better or gets worse, make sure to inform your doctor. Some side effects of taking Brenzavvy 20 mg tablet may include frequent urination, dizziness, or lightheadedness. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, it's important to tell your doctor if you experience any signs of a urinary tract infection, kidney problems, bone pain, unusual tiredness, nausea/vomiting, stomach/abdominal pain, trouble breathing, or any unusual symptoms in the genital/anal area. This medication may also increase the risk of lower limb amputation, especially if you have poor blood flow in the legs, nerve problems, foot ulcers, or have had a previous amputation. It may also cause dehydration, so it's important to drink plenty of fluids to prevent this. If you experience symptoms of low or high blood sugar, you should notify your doctor right away. If you notice any symptoms of a serious allergic reaction, seek medical help immediately. It's also important to keep in mind that this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. Before taking bexigliflozin, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other problems. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, pancreatitis, dehydration, alcohol use, low blood pressure, history of yeast infections, blocked or narrowed blood vessels, nerve problems, foot sores or ulcers, or if you have had an amputation. When taking this medication, you may experience blurred vision, dizziness, or drowsiness due to low or high blood sugar levels. It's important to avoid activities that require alertness or clear vision until you are sure you can perform them safely. Limiting alcohol use while taking this medication is also important to reduce the risk of developing low blood sugar and high ketone levels. During times of stress, such as fever, infection, injury, or surgery, it may be harder to control your blood sugar levels while taking this medication. If you are eating less or unable to eat due to illness, this can also lead to high ketone levels. It's important to consult your doctor as this may require a change in your treatment plan, medications, or blood sugar testing. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this medication, especially dizziness, dehydration, and kidney disease. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor, as pregnancy may cause or worsen diabetes. Your doctor may need to change your diabetes treatment during your pregnancy. It's unknown if this medication passes into breast milk, so it's important to consult your doctor before breastfeeding. Drug interactions have the potential to alter the way your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid making any changes to the dosage of your medicines without consulting your doctor first. Beta blocker medications, like metoprolol, propranolol, and glaucoma eye drops such as timolol, may prevent the fast or pounding heartbeat that typically occurs when your blood sugar falls too low. However, other symptoms of low blood sugar, such as dizziness, hunger, or sweating, are not affected by these drugs. It's important to note that many medications can affect your blood sugar levels, which can make it more challenging to manage. Before making any changes to your medication regimen, it's crucial to discuss with your doctor or pharmacist how the medication may impact your blood sugar. Be sure to check your blood sugar regularly as directed and share the results with your doctor. If you experience any symptoms of high or low blood sugar, notify your doctor immediately. They may need to make adjustments to your diabetes medication, exercise program, or diet. Additionally, it's important to be aware that this medication may interfere with certain lab tests, potentially leading to false test results. Make sure to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much of Brenzavvy 20 mg tablet and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Do not hesitate to seek help if you or someone else has overdosed on this medication. This medication is not meant to be shared with others. It's important to attend a diabetes education program to learn how to manage diabetes with medications, diet, exercise, and regular medical exams. You should also learn the symptoms of high and low blood sugar, and how to treat low blood sugar. It's important to regularly check your blood sugar as directed. Before starting this medication and while taking it, you should have lab and/or medical tests done, such as kidney function, blood sugar, hemoglobin A1c, cholesterol, and ketones. It's important to keep all medical and lab appointments. Consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take 2 doses to make up for the missed one. It's important to store Brenzavvy 20 mg tablet Antihyperglycemic-Sod / Gluc Cotransport-2, Sglt2, inhibitors at room temperature, away from light and moisture. Be sure to keep it in a safe place, away from children and pets. When you no longer need the medication or it reaches its expiration date, consult your pharmacist or local waste disposal company for proper disposal instructions. Avoid flushing it down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.